Alternative treatments women can try first before the extreme of surgery. To learn more on the subject, we welcome Dr. Jonathan Wheeler, gynecologist. Welcome, Dr. Wheeler.
Thank you. Thank you for having me.
What are some of the facts, the hardcore facts that women should know before they get a hysterectomy?
Well, today you have to understand the purpose of the hysterectomy. Tragically, we still do many of them abdominally through the old incisions. I was very fortunate at UC.
Alternative treatments women can try first before the extreme of surgery. To learn more on the subject, we welcome Dr. Jonathan Wheeler, gynecologist. Welcome, Dr. Wheeler.
Thank you. Thank you for having me.
What are some of the facts, the hardcore facts that women should know before they get a hysterectomy?
Well, today you have to understand the purpose of the hysterectomy. Tragically, we still do many of them abdominally through the old incisions. I was very fortunate at UC to be in the beginnings of minimally invasive surgery and endoscopic surgery for gynecologic causes. Since then, I think that we've seen people starting to understand that there are many other alternatives to them.
How do the diagnostics today compare to the diagnostics, let's say, 20 years ago?
Well, we have more access to ultrasounds, office biopsies, hysteroscopes in the office. We can make better diagnoses and treat the actual problem than blanket hysterectomy.
Now, I want to quote you correctly here, but I believe you're saying that we can have bigger surgeries with smaller sutures or smaller incisions. Is
Correct.
That it?
Smaller incisions.
What do you mean by that exactly?
Well, the biggest fear of a woman having a gynecologic issue is many times they're afraid to bring it up because they're afraid to hear these things about gaining weight, going through menopause, losing their ovarian function, not being a woman anymore. And that's the tragic misunderstanding of what gynecologic surgery is all about.
Now, you practice out of Hoag Hospital.
Correct.
What sorts of, quote, cutting edge, pardon the pun, techniques are available there that can't be found elsewhere?
A lot of it really depends on what the cause is. Many of these will be evaluated in the office, but if a woman does need a hysterectomy, she has to understand that she does not have to go through the old-fashioned incisions. Hoag is the recipient of 4 robots, which leads the county, and we have done more gynecologic surgery robotically than any other hospital in the area.
What's the advantage with a robotic surgery versus surgery that's all done manually?
Now, to understand, minimally invasive surgery is laparoscopic, which means very small incisions, less than 1/2 of a centimeter in diameter. The fact is that robots just facilitate and make the laparoscopic procedure easier. The beauty of this is that you don't have the long hospitalization. You reduce operating time, you reduce blood loss. Postoperatively, the pain is substantially reduced.
And I would imagine that being under anesthesia would be reduced as well.
Correct. Your anesthesia time and operating times are reduced.
How does the downtime for a woman on average compare with this type of procedure versus the regular abdominal procedure that's been done in the past?
It's night and day. I mean, when I started, I saw my patients coming in after an abdominal hysterectomy 6 weeks later, they're holding their stomach. Today, my patients are going home the day of their surgery. They're going back to work within a week. They're able to take care of their families. A lot of women are having children later in life. They can't have that downtime. They're busy women, they have jobs, so we have to get them back into their workload, into their natural environment as quickly as possible.
So if a woman is having some of the symptoms that we've described, the pelvic bleeding and so forth, endometriosis, what do you advise her to do? What should her first step be?
Well, understand the symptoms and then do the right diagnostics. If it's something that's small, it can be treated with small procedures, hysteroscopic, removals of fibroids, endometrial ablation. But if you need hysterectomy, you should probably seek out a person who is deaf or who has the ability of invasive surgery to reward you.
Well, I thank you very, very much for coming and being on the Healthy OC. Thank you for all this wonderful information. That wraps this segment of the Healthy OC. May you have a happy and healthy new year. I'm Heidi Cortese. Be well.
All right, thank you very much, Heidi.
Still to come on Real Orange, the art of being human.